I am absolutely humbled and at the same time extremely excited to be here today. Global Brigades is a group of extremely passionate students made up of hundreds and hundreds of chapters across North America and Europe. I'm just a representative of that movement and that passion. There are lots of people that came together to create Global Brigades, and it's on the weight and of the energy and the passion of the students. And I'm just to hopefully today give a small light into the impact that they've made over the last 10 years of working with them. So how Global Brigades operates and how we work is we take groups of university students from individual campuses and mobilize them to produce and implement health and development projects in Central America and Africa. And they take on shorter term projects, but because of their size and their ability to mobilize, certain groups can take on where other groups left off. And they can take on extremely large projects and complete them for the benefit of the community. And working alongside the community, they're able to perpetuate them with an amazing, and let me emphasize, amazing team of in-country local professionals and technicians. Global Brigades is not just about the students. It's not just about the wonderful community members and passionate leaders within those communities, but also those amazing technicians and professionals that really create the sustainability of our work. So when we say our logo is students empowering communities, it also reads the other way. It's the communities empowering these students. It's that learning experience, that serving with not the we're here to save you mentality, but we're here to work with you. And the students get more, much more out of the experience in many, many cases than the community members do, and it's in that humility that we work alongside them. So today I'm going to go over the basic idea of Global Brigades, how it became sustainable, and then how we ultimately scaled across North America and Europe. So the idea is under a crazy premise that students can make positive social change. And that they can actually do this in the form of very complex issues such as sustainable development and global health. Crazy? Maybe. We'll see. It started at Marquette University, at the time just doing medical relief work in rural Honduras. Now imagine a group of 30 students, a handful of doctors, suitcases full of medicine, remote poor village. That's medical missions that have been going on for hundreds of years, right? The difference was we said, okay, what happens, and we took a look, and the students and talking to the communities, what happens when that group of medical students and doctors leave? Who perpetuates that? We need, if we're going to do this and get involved in this organization, we want to make sure that there are licensed professionals there year-round to help these communities, and that we can monitor in the progress of them and have groups go back every 3 to 4 months to perpetuate. So when I went on one of the first Marquette trips, I didn't go to Marquette, but I was invited to go on one of their trips, and we talked to the executive, who's now the co-founder and executive director of Global Brigades, Enrique Rodriguez, and said, Kike, was it hard to get these community members to show up for these brigades? Because there's literally a line of 1,000 people outside, and most of the times when we were doing the medical. He's like, no, Steve. He goes, there's need all over this country. We need more groups. And I asked the students, was it hard to mobilize the group of 30 students? No. We had 150 people on our wait list. So because this is a social enterprise theme, I'm going to go into more of the business of Global Brigades. we don't talk as much about, but we'll get specific into the very fancy business of Global Brigades. Okay, we have a supply of people that need support and a demand of students that wanted to help, and we just matched those two together. So when I asked Kike, how did we calculate, because the students were contributing to participate on the program, how did we calculate the cost of what are we asking the students to contribute? He goes, well, we have the gas line item, this is how much we're going to need medicine, this is for the doctors, and we're just going to tally up those, and this is for those 8 days, this is what we're going to ask each student to contribute. What are we missing? All of the money to perpetuate the projects. All the money to actually provide sustainability, the money to hire Kike, and to have him do this as his full-time job. So we asked the students, and students' ideas, and again, we're all just in college ourselves at this point. So okay, we'll just raise a few $100 more, and with that margin, we'll be able to hire local teams that will create more sustainability to our work. So we went from medical relief to sustainability, and a revenue stream. that was built on the sustainability of the passion of individual chapter presidents and volunteers that wanted to mobilize and fundraise for their program that would then pay not only all the logistics of being in country, not all just the supplies that they were working with, but also the staff members that perpetuate the programs. And with our high amount of volume, we can operate super lean and with not asking too much from the program contribution, but still be able to make tremendous impact. So that's just from the revenue side. Well, what can students do? Well, as I said, it started out with just medical. But then it kind of got tiresome to just continue giving parasite medicine every 4 months to the same communities. You guys learned all today about the challenges, so I'm not going to go into each one in specifically. The water issues, the access to capital, access to education, all very complex. But what do we have as students? What's our strength? Our friends and our ability to mobilize our friends from across disciplines and across the campus to help in these other causes. So where we were bringing medical pre-med students first to do medical relief, we started bringing down business students to help with micro-enterprises. We started bringing down engineers to build water projects, public health students to do infrastructure. And I'll just go through, obviously, the medical and dental programs, the microfinance, all student-led programs that mobilize together. And then we started getting a little bit more sophisticated with environmental projects, agriculture projects, human rights brigades. Actually bringing local attorneys and listening to the legal needs of these communities, community members, and helping them through their conflicts. And ultimately, architecture and construction infrastructure programs where we work with the local governments to build clinics and schools and make sure that they're staffed appropriately with the commitments from those local governments. This holistic approach is how we enter these communities and how we ultimately exit them. This year we exited our first community in Susalar based on this model. Our community bank that we helped establish was financed up to the point where it will be able to perpetuate all of the local community councils, to perpetuate the public health programs, to perpetuate the water system that we built, and to help fund the schools and for the teachers. At that point, the brigades no longer need to go there. We can sustainably exit that community and just hire the people to do the follow-up work and maintain those relationships over time. So does that mean we leave completely? No. It means the students leave. It means that we still have that team that's really following up and making sure that sustainability exists. So you have a sustainable model. Now how are you going to scale? Global Brigades is an exercise of scaling, as you can see with these charts. Oh, barely. In 2004, we had 2003, 2004, when we started, we had 30 students. This next year, we're going to mobilize 10,000 students. More people abroad than the Peace Corps. All university students on an annual basis. For each one of those students, there's a direct impact to the beneficiary. For every pre-med student, about 20 patients are served. For every student going on a water program, 3 to 4 people will have access to clean water in their home, and not just like an actual water system chlorinated into their home, whereas they were drinking out of rivers or other lack of access before. That direct impact of scalability is critical. That as we grow as an organization, not only are we growing financially stronger, but the impact also improves and that we have enough resources to make sure that we're not afraid of scale, that we're not afraid of growing, but we're doing it responsibly, and that we ensure that those practices are in place to not let down the most important people why we're doing this, and that is the community members themselves. So the call to action is join the movement. Not necessarily Global Brigades, although that would be great if you don't have a Global Brigades chapter on your campus. But join this health and sustainable movement. And you've already done that by coming here today, showing your passion and dedication, willing to learn. But get involved too, and not necessarily with just your own idea of startup, but Saul Garlick is coming in with Think Impact, a great organization to participate in. Get engaged, get in the field. For if it's a week or a month, start understanding and learning what these problems before and what the assets are in these communities are. And I'm going to use the word assets, what the assets are in these communities. To then start slowly developing out your own ideas. And when you have those ideas, feel free to contact Global Brigades, and hopefully you can participate in this next year's business plan. Thank you so much for your time today. I appreciate it very much. Thank you.